Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.
Gina Walkington of Bristol is a Democratic candidate in the 61st Assembly District. Gina, welcome to WisconsinEye.
Hi, thank you so much for having me.
Your campaign website identifies several issues. We need to invest in our infrastructure. How would you break the impasse over funding our highways?
You know, it's clearly a very complicated issue. I think that there are a few different viable options. I think that when we're looking at investment and where we're investing our tax dollars, we really have to have some priority levels, and I don't see that our infrastructure has been one of our priorities. I would really like to, have some conversations with more stakeholders, do some more research to speak in specifics about plans, but I think that it's something that we definitely need to prioritize.
Do you think it's time to potentially raise the gas tax? You've heard of all the discussion about that. Something you would consider?
Again, I think it's a very viable option, but again, not having looked at all of the options and the bigger picture about what goes into it, it's hard to say. I hesitate to say yes or no, but it's definitely something to consider. And
then the talk in the Capitol about tolling. Have you taken a position on tolling?
I, at this point, would say probably no to tolling. I think it puts our money into private companies and creates a situation where it may not be as easy to make road improvements or change things the way we need to.
On your campaign website says we need to better fund public education. So the current increase in aid to K-12 schools in the current budget, you don't think is enough?
No, I don't. I don't think it's enough. I think, it barely puts us back to where we were years ago before, all of our funding was cut. And it certainly doesn't consider the cost of inflation, or the rate of inflation, sorry. So I think that we need to be doing more. And I think that the voucher program is taking a lot of money out of our public schools that could be used to make sure that they have the resources that they need.
Would you freeze the voucher, the choice program, or would you dial it back, or would you try to get rid of it entirely?
Without looking at the details, it's hard to say definitively. My gut is to phase it out. I think that if we're giving public money, taxpayer money to schools, should be to public schools, and they should be held to the same standards that public schools are in terms of curriculum and teacher training.
With the tragic mass shootings and school shootings, do we need to change our gun laws?
We do.
How?
So, one of the most heartbreaking conversations I've had as a parent, I have 3 young boys, my oldest is in 4th grade, was the morning after Parkland, and I let him know what had happened because I knew he would hear it that day at school, and we talked through their drills, their lockdown drills, and he said to me, we're upstairs, if something happens, we're trapped. And it's heartbreaking that that's what our kids are feeling going to school. So I think, we definitely need to take a look at our gun laws. I am absolutely in support of expanding our background checks to a universal background check system, and 84% of gun owners in Wisconsin feel the same way. They're supportive of it. I think looking at the waiting period and expanding that a bit is reasonable, and I also think that we need to consider some red flag legislation that allows guns to be temporarily, or firearms to be temporarily removed from a situation where that person may be harming themselves or others.
Your campaign website says also identifies the creation of jobs, but compared to other parts of the state, isn't your area kind of booming with Haribo and Amazon and now Foxconn, things like that? So why have you identified the creation of jobs as a priority?
So I think the distinction, because you're right, we do have an influx in the district of businesses opening and corporations moving in, and we have we're at a near all-time low for unemployment in Wisconsin. I think the gap and what we're really missing is jobs that are paying a living wage and are able to support our working families and really able to strengthen our middle class. There's a lot of people who work 2 to 3 jobs and still struggle to put a roof over their heads and food on their tables. The price of healthcare is still increasing. The price of prescription medications is increasing. So I think we need to invest in jobs that are supportive of our working people and provide a good living.
What should the minimum wage be in Wisconsin?
That's a hard one to answer. I think we need to take a look at the cost of living and make sure that we are being paid a living wage as an alternative to, I guess, a minimum wage. Things have really changed from where we were 20 years ago, where minimum wage jobs were taken by, high school kids or, our younger generations or our younger people. Now it's parents, it's people who, are trying to support families, and that's just not sustainable.
You mentioned Foxconn earlier, the $4.5 billion in state and local potential tax breaks and incentives. Is that a good deal for Wisconsin? Is it a good deal for Southeast Wisconsin, your area?
No, it is not.
On both counts?
Both counts. I think that we have set a really, really dangerous precedent in the deal that we have given to Foxconn. I worry that in the future, it is setting us up for failure. In the future, companies are going to ask for the same thing or more and not settle until they get it. And so what does that look like when we want to bring more jobs and more diverse employment into our state? I think the money would have been much better spent being invested in Wisconsin businesses, in small businesses, because I think that those are the type of places that are really the backbone of our communities and really support our community members.
As you campaign in the 61st, are most residents in favor of the Foxconn deal, or do they have questions? I mean, have you been able to establish if there is a position?
Yeah, it's interesting because last summer when the Foxconn deal was announced and passed, I was very surprised at the popularity of it on both sides of the aisle. And the shift in that is very noticeable now.
Really?
So at the doors, when Foxconn is brought up, I've even talked to some people who are currently employed in the construction of the site, and they are very grateful to be employed and have that steady job. It's closer to home, but they're very worried about the long-term impact of what Foxconn is bringing. So I think people are starting to be more and more uncertain as the days go on.
3 questions on healthcare. Let's talk about healthcare in rural areas. Rural areas, you have older people, you have young people leaving, you have government, Medicaid, Medicare providing more healthcare. Thoughts on how to continue and maybe improve rural healthcare?
Yeah, I think a big problem, not just in Wisconsin, but in our country, is the price of healthcare and the price of prescription medication. I think that we need to take a hard look at what we can do to bring those costs down. And I think access in rural areas is a really big problem as well. So looking at how can we attract more healthcare providers who are offering affordable but adequate and safe healthcare options, so that people don't have to go so far. You don't have to wait weeks and weeks to get your child seen, or as a senior, be seen for something that's potentially you don't have a lot of time to deal with. I think that's something that we need to look at.
So you think state government has a role in retaining and recruiting doctors, physicians, and other professionals, medical professionals?
I do. I think it's our responsibility as elected leaders to make sure that, our constituents, the people in our state or our districts are being taken care of, or at least have the access and the options to take care of themselves. Governor Walker recently put $6.8 million into an ad campaign to recruit workers to come for Foxconn. I can't help but think that if some of that money could have been spent in recruiting healthcare providers, that could go a long way.
Last question on healthcare involves a dental issue. Medically underserved Wisconsin residents are eligible to receive dental treatment through a program sponsored by state government and Delta Dental. Some of these clinics are struggling financially because of Medicaid reimbursement rates. In the next budget, do you think these preventive dental programs should remain a priority and perhaps expanded?
Definitely. I think dental services and dental coverage is something that has been forgotten about, and I think it's really ties into our overall health, and I think it absolutely should be a priority.
Levy limits on local governments. Some local government leaders say they feel, this is their term, strangled by local levy limits and their ability to provide local services. Do we keep them in place, dial them back, or get rid of them?
You know, that's funny that you use the word strangled. I've been talking to leaders and elected officials in communities across the district, and that's the exact phrase that they use. They feel that their hands are really tied, and I think that government operates best when it's closest to the people. I think that, you know, local municipalities, village boards, county boards, they know best how to meet the needs of their residents, and if they don't, there's always an election year coming up, right? So I think that we need to empower local governments to be able to make those decisions and be able to fund the services that are needed and meet the needs of their towns, and they're all unique. So
a big issue in the next state budget is whether we need a new state prison. The prison in Waupun and Green Bay are built in the 1800s. We're closing the 2 juvenile prisons. Do we need a new state prison?
So yes, we do. Caveat that by saying I am not for building more of the same. I think when we look at our prison system, and it is important to make sure that, you know, our facilities are up to date, that we have safe conditions for not only the inmates but the correction officers and the staff that's there. But we really need to take a look at where these facilities are located, the family separation that happens when inmates are moved, and really make sure that we're not only investing in new facilities, but that we're investing in programs that are helping to lower our prison population rate, and making sure that we don't have, that our recidivism rates are low. So, you know, what can we do to rehabilitate some of these people? Can we look at sentences, you know, being shortened a bit, education, so that when they're re-entering society, they're going to be productive members and be able to really just blend back in.
Thoughts on next steps and how we fight the opioid, methamphetamine, and heroin epidemic?
So this is, I think, a really multifaceted issue. I think that it plays into a little bit of our criminal justice system. I think we criminalize mental health and addiction way more than we should. I think that expanding access to healthcare providers in areas that don't have a lot, especially mental health services and addiction services, would go a long way. Yeah, I think we need to just take a holistic approach and make sure that we're treating the whole person and we're treating what's at the core of it, and not just the crimes that have been committed because of the addiction.
Part of this debate involved the proposals to legalize both medical marijuana and recreational marijuana. Your position on those?
Sure. So I ultimately am in favor of full legalization.
Of medical or
of
both?
Of recreational,
okay.
Of both, yeah.
Thank you.
I think that, you know, it may take a while to get there. It's one of those cultural shifts that, you know, isn't easy. So critically first, I think legalizing for medicinal purposes should be a priority. That goes into so many things with healthcare and the opioid epidemic. It's hard to see, and I have a few friends and family members who, you know, are dealing with being on long-term pain plans or pain management plans,
yes.
And to see them spend a ton of money on prescriptions that the prices just keep increasing. The prescription medicine doesn't adequately help their condition or improve. Knowing that there is an alternative that is safer and more affordable, but it's just out of our reach because we haven't crossed that threshold yet. It's frustrating. So I think legalizing it for medicinal purposes first is a critical step to take.
And then last question, differences between you and the incumbent that you're challenging on November 6th?
Sure. So, my opponent is the longest serving representative in the Assembly, and I have to give her credit for her public service and the time that she has put in. I also think that, people in the district are ready for a change, ready for a fresh perspective and new ideas. There's been adequate opportunity to show her commitment to doing what's in the best interest of her constituents, and it hasn't been there. Prioritizing where our tax dollars go, prioritizing making sure that everyday people, working people, homeowners, our taxes don't skyrocket is really important, and that hasn't been happening.
Okay, understand. Gina Walkington of Bristol is a Democratic candidate in the 61st Assembly District. The general election is November 6th. Gina, thank you for talking to WisconsinEye.
Thank you so much.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.